Assalamu alaikum. In this session, we will discuss burn. About burns, it is damage on the layer of the skin, fat, muscle, and even sometimes it will reach the bone. It is caused by either heat or chemical or electricity. So burn it might happen due to any of those causes, either due to dry heat or due to hot fluid or due to chemical substances, either like strong acid, strong base, and it might be due to electric shock. What to look for in case of burn? Signals of burn depend upon uh, whether the burn is superficial, partial thickness, or full thickness. So it can be divided to superficial burn, partial thickness burn, and full thickness burn. The superficial burn, it will involve only the top layer of the skin, the epidermis. So in this case, the skin become red, dry, and usually it is painful. Painful because most of the nerves are there in the skin that will give the pain, and it might lead to swelling. Usually healing within week without scarring, without any side. The second type of burn, which is the partial thickness burn, it include the top layer epidermis and dermis. In this case, the skin become red, painful, and have blister that might be open and weep a clear fluid from it, may appear mottled and often swollen, usually heal within 3 to 4 weeks, and scar might be there. The full thickness burn may destroy all the layer of the skin and underlying structure, fat, muscle, bone, and nerve. So skin may be brown or blacked, extremely painful or relatively painless. Healing may require medical assistance. Scarring is likely to happen. When to call 9999? We have to call for emergency help in case if there is trouble with the breathing, if the burn cover more than one body part or a large surface area, if we suspected burned airway, if it is affected the airway, if the burn on the head, neck, hands, feet, or digitals or fingers. Full thickness burn on victim younger than 5 years old or older than 60 years old. Burn caused by chemical explosion or electricity. So in all of those cases, we have to call for emergency, transfer the client to hospital. What to do until help arrive? In heat or thermal burn, we have first to check the scene for safety. So if the scene is unsafe, in this case, we will don't be the second victim. Then stop the burning by removing the person from the source of burn and check for life-threatening condition Then cool the burn with large amount of cold running water, at least until the pain is relieved. So we will put the client, the site of the burn, under running water, cover the burn loosely with sterile dressing, comfort and reassure the victim. We should not apply ice or iced water to the burn. Do not touch the burn with anything ex uh, except a clean covering. Do not, if blister is there, it should not be breaked out. We have to keep it intact. In case of chemical burns, we have to brush, especially if the chemical is a powder, we have to brush off the chemical using gloved hand or a towel. Flush the burn after that with a large amount of cool running water continue for at least 20 minutes or until the emergency medical support personnel take over. If the burn is in the eye by chemical, we have to flush the affected eye with water until the emergency medical support personnel take over. Remove contaminated clothes if the clothes is contaminated with the chemical substances. About electrical burns, we should never go near the person until you are sure that he or she is not connected with the power source. So the first step that we have to do is to turn off the power source and prepare to perform CPR care for shock and thermal burn. Because in case of electrical burn, shock might happen and cardiac arrest might happen in severe cases. So we have to be prepared for that. Look for entry and exist of the wound and give the appropriate care for that. We have to call for emergency in those cases because we don't know what's happened inside. So it is better, it is always better to call for emergency or transfer the client to the hospital.
Merchandise, fabulous and exciting bonus prizes, including this. Experience the sporty, stylish...
Yeah, it's right out here. Ah!
A burn is a special type of soft tissue injury caused by exposure to heat, chemicals, or electricity. Check the scene for safety, since burns caused by chemicals or electricity can be a danger to you. Burns by heat are the most common. There are 3 types of burns. Burns that may only affect the surface layers of the skin. Burns that are more severe, that form blisters and affect deeper layers of the skin. And the most severe burns, which can affect the skin and soft tissue down to the bone.
Well, you don't mind if you drink another cup here.
Flip-flops. You do.
I bet they're pretty.
I do too.
You do? Just wait right here. I'll be right back.
To care for a burn, follow these general steps. First, stop the burning. Then cool the burn with large amounts of cool water. And then cover it with dry, clean dressings to help prevent infection. You must call for an ambulance if the victim is a child or elderly person, or if the victim has difficulty breathing, has burns that cover more than one body part, has burns to the head, neck, hands, feet, or genitals, or has burns from chemicals, explosions, or electricity. If the burn is caused by chemicals, flush the burned area with cool running water to stop the burning and cool the burn. If the burn is electrical, check for life-threatening conditions. If there are none, cover the burn and care for the victim until the ambulance arrives.